I happened to be having lunch one day when a young fellow walked past and said to me, "Hi, Mr. McMeekin. I'm Richard Cohen. I work for the city drug addiction, but I'm really impressed with what we're trying to pull off with this PHMC thing and would love to be involved." I said, "Give me your name. I'm sure we'll have something for you." 5 years later, with my retirement, a successor was needed to still carry a very wobbly experiment in collaboration forward. We needed someone willing and able to compromise and collaborate and carry PHMC forward. Enter that young city health staff member who I had previously met. His name, Richard Cohen, and the fact that he embraced the idea of managing with compromise, consensus building, and a kind of win attitude. And the rest, for the next almost 50 years, has been history.
I think what many miss is that PHMC is a model in the nonprofit world and services to those in need nationally. We, to some degree, may take it for granted, but others look to PHMC as a best practice to mirror. And so we have this crown jewel in our region that serves our most vulnerable that only happens because of the exceptional leadership of Richard Cohen.
So Richard's belief in the power of design, not only its ability to, but actually his requirement or his demand that design be in the service of those who use the building. His belief that those underserved communities, or often underserved communities, deserve design that is, as good and even better than those who don't have that kind of access. And then for his staff, an understanding that the work that they do, it's really challenging work.
Being a new executive, I'm constantly looking for people to emulate or people that I could take things from. And one of the things that really struck me about Richard was that he had this grandiose vision for PHMC. And another thing that I really appreciate about Richard is just his commitment and his understanding that all people, regardless of who you are, where you come from, deserve to be treated fairly.
PHMC has grown enormously under Richard's leadership. Richard has always had a vision that public health should touch people in every single way. And so while we were on the board, this entrepreneurial spirit of taking care of people who work for PHMC, taking care of the people in the community, ensuring that we were making a difference.
I mean, Richard is the ultimate positive person, and so it's always a pleasure to talk to him on the phone. It's always a pleasure to get updates from him, because it's all about positive energy, all about the next step forward. He's had a vision for this place probably since 1972 when he got here, and he's been executing that vision since then. I think he's going to leave this place in a very good stead for the next leader to come along and continue to implement that vision.
Richard is what I would call a relationships guy and a connector. Richard would be focusing on how to provide a public health service and expand into a different operation, and I would be focusing on cash flow, staff coverage.
As I've watched PHMC grow, not just in size, but in its impact on our community, I've often thought about how holistic Richard thinks about public health. And while it's a little bit more fashionable today, when I first met him 10 or 12 or more years ago, he pretty much had some critical thinking going that helped us redefine public health to include emotional health as well as physical health and even health education. So it's been frankly joyful to watch him tactically bring all that to life over the last 10, 12 years.
Richard is a very talented person, but he also has a lot of passion. He feels strongly about things, and he conveys that to other people. And I think it's important for a leader. One of the things I've learned from Richard is that it's important for a leader to be passionate. It's important to show a lot of energy, particularly when times are difficult. Right? Because among the jobs of a leader is to show that we can get through this. And Richard is excellent at that. So I've learned a lot of things from him, but that's one of the things I'm most aware of.
Richard has demonstrated an excellence in health administration through his many years of practice. He provides strong leadership, visionary leadership, and engagement.
I got an opportunity to go and tour the work that PHMC is doing in Philadelphia, and I was blown away. And the only thing that I could think of is like, this is leading edge kind of stuff, and it's innovation. And that's when I think of PHMC, that's what I think of innovation.
What is extraordinary to me, frankly, is that PHMC is only 50. I would have imagined, if I didn't know better, that an organization of the scale, an organization as deeply integrated into the fabric of Philadelphia as PHMC is, I would have assumed had been there since the 1800s.
Thank you for all you have done for the public's health and for what lies ahead. With your new endeavors leading the foundation, please know it will be my continued honor to collaborate, and remember, I have your back.
Richard, you have been with me as a mentor from the very beginning. You have been an inspiration personally and also organizationally.
Richard, congratulations on your retirement. You've been just a gem to work with, funny and wise. Thank you for your leadership. Thank you for your mentorship. And just thank you for you.
My first memory of you is at the annual meetings when you would have your long list of ribbons, and I always strove to try to beat you, and I never did. So best of luck, and don't go away.
I wish you only the best, and I know you're going to continue to do wonderful things. Mazel tov!
Richard, congratulations on 40 years of blood, sweat, and tears that you poured into making PHMC a leader in public health service delivery in the region.
It has been such an honor to work with you, and I wanted to thank you for all of your leadership, your guidance, your enthusiasm for all of the work that we have done here to improve the health and wellness of all the people we serve here at PHMC.
Words cannot express the appreciation and respect that I have for you and your leadership over the past 50 years. In your retirement, take time for yourself and your family. I wish you nothing but the best.
Richard, I just want to say thank you for your dedication, your leadership, and your advocacy for all things public health. This is not a period, but a comma in the chapter of your life, for the best is yet to come.
When I think of you, Richard, you're like a captain of a ship. You kept PHMC steady, anchored, and driven for 40 years, making PHMC what it is today and one of the best public health organizations in the United States. In your famous words, at every PHMC annual meeting, is thank you for all you do. Thank you for all you do. And thank you for all you did, Richard.
Congratulations, Richard, on so many years of successful leadership at PHMC. PHMC has been a great partner to the city of Philadelphia and has done so much over the last 50 years to serve Philadelphians in every neighborhood. We appreciate everything that PHMC does to improve public health throughout our city and region, and wish you the best of luck.
To all my friends at PHMC, congratulations on a half a century of incredible work in the greater Philadelphia community. And I want to say a special thanks to Richard for doing more than 40 years of incredible service, leaving an indelible mark on our community, leading to healthier outcomes, safer communities, and stronger families. I want to also thank you all for the important work that you've done in collaboration with the Attorney General's office. And I look forward to now serving as your governor and continuing to find ways to collaborate, work together, and get big things done. And for Richard, as you move on to your next chapter, know how much we appreciate your service and your sacrifice, and know that you left an important and indelible mark on our communities. Thank you.
Congratulations, Papa. We love you.